Today, we're going to dive into what happens when the body's most delicate and important signals, the ones that connect our brain to our bladder, get their wires crossed right from birth. It's a look at a really complex medical challenge, but, it's also an incredible story of scientific progress that has absolutely transformed lives. So let's get into it.
First, we'll break down what that broken signal really is. Then we'll look at how a simple vitamin sparked a massive public health revolution. After that, we'll see how doctors can literally look inside the system, the amazing ways they manage the condition, and finally, what this lifelong journey of not just surviving, but thriving looks like today.
All right, first up, a broken signal. Let's get right to the heart of the problem. What is actually going on when this critical communication line inside the body just breaks down?
So what really happens when these signals get crossed? Well, imagine trying to send a super important email, but whoops, the internet cable's been cut. The message just doesn't get through, or it comes out all scrambled. When that happens inside the body, right from birth, the consequences for the urinary system can be really serious.
The fancy medical term for this is neuromuscular lower urinary tract dysfunction. But honestly, the easiest way to think about it is like a faulty electrical circuit. Your brain is the control center, the bladder is the appliance, but the wiring between them is damaged. So the bladder just can't get the right commands to do its job, to store or empty urine the way it's supposed to.
So what's causing this faulty wiring in the first place?
Well, the most common reason from birth is something called a neural tube defect, or NTD. You've probably heard of it as spina bifida, and this happens in the very earliest weeks of pregnancy when that tiny little structure that's supposed to become the brain and spinal cord doesn't seal up completely. This image here shows myelomeningocele, which is the most severe form of spina bifida. You can see the spinal cord itself is actually exposed on the baby's back. This is literally the physical source of that broken signal. All the nerves that control everything below the spot, and that includes the bladder, are directly affected from day one. And where this opening happens on the spine is absolutely critical. Just look at the data. It's overwhelmingly found in the lower back, the lumbosacral region. We're talking nearly half the cases right there. And that is no coincidence. That's precisely where the nerves that run the bladder and sphincter originate. So the location of the problem tells you a lot about the impact it's going to have. But here's the thing. This story isn't just about the problem. In what is truly one of medicine's great public health victories, science found a powerful way to help prevent it. And that is the folic acid revolution. And things moved incredibly fast. In 1991, huge studies confirmed that a simple B vitamin, folic acid, could slash the risk. Just 1 year later, a major public health recommendation came out. And by the end of the decade, governments were actually mandating that folic acid be added to staple foods like flour. Think about that. From science to life-saving policy in under 10 years. It's amazing.
And the results? They were just staggering. Taking a supplement can cut the risk by up to 70%. And even just fortifying food, that alone led to a drop of up to 50%. This simple, inexpensive vitamin has prevented thousands upon thousands of families from ever having to face the challenges of a neural tube defect.
But here is the catch, and it is a really, really critical one. That neural tube, the thing that becomes the spinal cord, it's fully formed and closed by day 35. That's just 5 weeks into a pregnancy. That's a time when many women don't even know they're pregnant yet. This is exactly why having enough folic acid before you even conceive is so incredibly vital. It's all about being prepared. Now, of course, prevention isn't perfect. And for the children who are born with the condition, the next step is all about diagnosis. Doctors have to get a clear picture of exactly what's going on inside their urinary system so they can protect it. So to get that inside view, doctors have a few key tools. An ultrasound gives them a first peek at the kidneys, just to check for any swelling or damage. A cystography checks for a really dangerous problem called reflux, which is when urine flows backward up toward the kidneys. And then there's the most detailed test of all, urodynamics, which actually measures bladder pressure, a vital clue we're about to talk more about. And this right here gets to the absolute heart of why all this testing matters so much. Job number 1, above all else, is to protect the kidneys. A bladder that stores urine at a really high pressure is like a plumbing system that's constantly backed up. It puts this relentless, dangerous force on the kidneys. And over time, that pressure can cause damage that you just can't reverse. This is why that urodynamics test is the gold standard. It's the one test that can definitively tell doctors if a bladder is safe or if it's hostile, meaning it's storing urine at dangerously high pressures.
The results from this single test basically write the entire game plan for that child's treatment.
Okay, so this brings us to management. Once they have that diagnostic data, doctors can stop reacting and start being proactive. Let's look at the innovations that took this from a life-threatening condition to one that can be managed really effectively. The absolute cornerstone of modern management is a technique called clean intermittent catheterization, or CIC, and the idea is just revolutionary in its simplicity. Use a small, clean tube to empty the bladder on a regular schedule. This one act prevents the bladder from overfilling, it keeps the pressures low, and it protects the kidneys from that harmful backup. It was a total game changer. Medication is the other part of the 1-2 punch. So look on the left, that's a urodynamics reading from a hostile bladder. See how it's having these high-pressure spasms even when it's not very full? But now look at the right. This is after a common medication. What a difference, right? The pressure stays nice and low, which allows the bladder to hold a lot more urine safely. This is how medicine can literally calm down a hostile bladder. And when you combine these two things early on, CIC and medication, the benefits are just astounding. Infections plummet, kidney scarring drops way down, fewer kids end up needing major surgery. And here's the big one, the risk of end-stage renal disease, which means needing dialysis or a transplant to live, it drops from nearly 1 in 3 kids down to less than 2 in 100. That is a monumental achievement. And when those first-line treatments aren't quite enough, doctors have even more tools in the toolbox. Botulinum toxin, or BTA, can be injected right into the bladder muscle. It basically works by telling those overactive nerve signals to just quiet down. The muscle relaxes, the bladder's capacity goes up, and the pressure goes down. It's another powerful way to keep the whole system safe. Okay, so finally, let's see how all of this comes together for the long haul. Because thanks to all these advances, the story has shifted so dramatically, from one that was just about survival to one that is now about thriving for an entire lifetime. This statistic it's just mind-blowing. Before 1960, if a baby was born with this condition, it was almost always a death sentence. Fewer than 10% of infants survived. Today, because of the proactive care we've just been talking about, more than 90% do. It's a complete 180-degree reversal, a true medical revolution in our lifetime. And with survival now being the norm, the whole focus has shifted to quality of life in adulthood. And that includes relationships and having a family. We now know that the vast majority of women with spina bifida can have children. And while many men do face challenges, there are effective treatments available. The key takeaway here is that a full, rich, complex adult life is now the expectation. And so that leaves us with a new question for a brand new era. We've gone from a crisis of survival to this new frontier of lifelong wellness. The challenge isn't just about keeping patients alive anymore. It's about ensuring they can live the longest, healthiest, and most fulfilling lives possible. So what does that next revolution in care look like? Well, that's the question driving medicine forward today.